Hello, everyone. Welcome. And this is the first ever Perley Health CEO Town Hall. And as I said, I'm Jay Innes, the Director of Communications, and I'll be your host for today. We're delighted to see such a great turnout for this 60-minute town hall. And I noticed that a lot of our members of the leadership team are here as well, and I thank them for that. They will be here also to assist with questions when we get to the question and answer portion. Assisting me behind the scenes, running all the technical aspects, is Tom Lilly, another member of the communications team. And before we start the main presentation with CEO Akash Hoffer, I'd like to take a moment to cover some of the housekeeping items to ensure a smooth and productive session. Each participant has been automatically muted. Closed captions are available through Zoom. We encourage you to actively participate, but we ask that you hold your questions and comments until Akash has completed his presentation. We'll host that question and answer session after Akash has completed his presentation. This meeting is being recorded and will be broadcast on the Perley Health website. While video participation is welcome, it's entirely optional on your part. We ask that you avoid sharing personal information. We ask that you help maintain a professional and respectful environment. For the question and answer session, I am your designated moderator for the session, and there are two methods to ask a question. The first, using the button on the bottom of your screen, you can raise your hand. The system will automatically place you in order so we can identify you and invite your question. When asking your question, please limit your question to one so that we have time for other people and everyone to participate. You can submit your question another way through the chat function. This will be seen by all participants. I will then read your question or paraphrase on your behalf. We aspire to be fair and equitable at all times, and we thank you for your patience and support as we launch this new communications channel. While we strive for a seamless experience, occasional technical gremlins can arise in these meetings. If we encounter any issues, we'll take a brief pause to troubleshoot, and I'll thank you in advance for your patience and support. Also, we reserve the right to remove participants who violate these terms, and by joining the meeting, you agree to these terms. If you have a personal issue or concern that cannot be addressed during the town hall, or you think of something after the fact, you can always contact us at info@perleyhealth.ca. Thank you again for your cooperation, and now let's get started. Over to you, Akash Hoffer, Perley Health CEO.
Thank you, Jay, let's make sure I'm unmuted. I am, right? Okay, we're good. Thank you for that introduction. Welcome, everyone. Thank you for welcoming me into your kitchens, your offices, your homes, your workplace, wherever you may be. I just want to spend a minute summarizing what we're hoping to accomplish here this morning. Really, first and foremost, it's to say thank you. At the same time, I want to share information with you. And we have a diverse group of attendees here. So for some of you, this could be, what I'm about to say could be old news, or it could be brand new. Hopefully you gain something from it. I always do. So that's really the third reason we're doing this, is to hear from you. I do not intend to speak for the whole 60 minutes. And so I'll move right along. In case any of you are wondering, I don't have any bad news to share. Sometimes these meetings are called to say, like, there's something horrible about to come. I'm sorry, I don't have anything horrible to say. So I'm going to cover quite a bit of ground in a short period of time. Everything from our People First initiatives to some of the improvements that our team is making to resident quality of life and our plans for the future. So, Tom, if we can launch the slide deck and go to the second slide, please. There we go. Great. Okay. So let me first start by saying thank you to our staff and volunteers. You have made a huge difference to our residents. And our residents, as some of you know, as all of you probably know, some of them are coming from some pretty dark places before they are admitted to Perley Health. Some of them are coming from full-blown crisis situations. And we give them relief, comfort, and security, which is such a huge gift. And sometimes I wonder if those gifts are actually appreciated or felt even more strongly by the families who surround and support our residents. I have one quick story to share to illustrate that. I was standing in my driveway about a month or two ago. It was pitch dark and a car pulled up. And I felt myself becoming a little bit defensive. But then this person popped out of the car. He looked vaguely familiar. He said, "Hi, my name is Wayne. I live behind you on the next street, a few houses over." And I said, "Hi, Wayne, what's up?" And he said, "You work at Perley Health, don't you?" And I said, "Yes, I do." And then he went on to express his deepest gratitude for the care that we were providing to his loved one, which I believe is his mother-in-law, who's a veteran, who had recently been admitted. And he was just so grateful that she had accessed this beautiful oasis that we have here. And he wanted me to pass on his thanks to all of you, which is what I would like to do. I hear that time and time again. I've felt it myself. Just again, that sense of relief and security that people gain, knowing that their loved one is here and safe. And it could not be done again without the total commitment of our staff and volunteers, some of whom are on this call. So thank you. We in Canada are facing a bit of a demographic shift. What is happening is that there are now more people over the age of 65 than there are under the age of 15. Mm-hmm. So we don't have enough people entering the workforce. So one of our strategies at Perley Health is called People First. And you may have heard about this. Really what it is focusing, prioritizing staff retention and building relationships with our staff and volunteers. Some of the work that we're doing is being as responsive as we possibly can be to employee engagement results, for example. We're doing work to increase leadership visibility, to engage as much as possible with our staff. And also on the administrative side, we're doing a lot of work within a regulatory framework that sometimes constrains us, but to show respect for our staff. So for example, we're very, very pleased to be able to reach an agreement with CUPE for early retroactive payments prior to arbitration. We're doing work on psychological health and safety, which hopefully you've noticed, creating safe spaces, and just hopefully hearing from all of you on what else we can do to support you. And I think the results are starting to show. We've seen a very significant decrease in vacancies. And knowing that there are fewer people entering the workforce, we're very pleased to see that happen. We also, in the last year, our turnover rate has dropped by 1/3, which is remarkable. And we're just very, very pleased to see that kind of outcome. We're also working hard to foster strong relationships with your unions. And there are all kinds of mechanisms that if you're a member of a union, you have to voice your concerns. The first mechanism we always encourage is that you talk to someone, talk to your supervisor if you have concerns. But ultimately, if that's not working for you, you have every right to ask your union to file a grievance. We're very pleased to see that grievances have reduced by 50% in the last year or so. And hopefully that's a sign of even better things to come. Speaking of people first, we are always looking for new ways to support our staff. And one of the things that we've been working on that maybe you've heard about is an intergenerational childcare program. So if we can go to the next slide, Tom, please. It's funny, when we started talking about this many, many years ago, we talked about, well, we had a new building going up at the time, and we said, why don't we put a childcare in there? And people thought we were crazy mainly for infection and prevention and control reasons. Those concerns now have been addressed. And you may have noticed that we have an intergenerational program that's already underway. We have children visiting, interacting with our residents, with our tenants, and getting some very, very positive engagement there. The work is not done. Ultimately, our vision is to establish a childcare center right here on site. And there's been a lot of very positive work and progress that's been achieved there. One of those is a very strong relationship and partnership with Andrew Fleck Children's Services. They're a very reputable nonprofit childcare provider here in Ottawa. And we know that our staff who have preschool age children sometimes have great difficulty finding affordable childcare. And even when you do, it can be very inconvenient, very far away from work or home and so on. I went through the same thing myself many years ago. And so this is one of the reasons that we're looking at having childcare right here on site. It's to support our staff. But also a very pleasant side effect, I believe, will be growing that intergenerational relationship with the rest of the community here. And we know examples from other long-term care homes around the world show that you can get amazing results. You can actually measure greater satisfaction among residents, greater mobility, all these kinds of things. So we're super excited to move that along. It's not moving along as quickly as we'd like. However, a lot of the building blocks are in place. As I said, we have this great relationship with Andrew Fleck. They have a great relationship with the Ministry of Education, which is the ministry that funds childcare. Andrew Fleck has been awarded 49 affordable childcare spaces to construct here. What is not clear yet is the funding formula. So they're working hard on getting clarification on that. And as soon as that falls into place, we'll have a green light to forge ahead. So we're just thrilled to move that along. Tom, can we go to the next slide, please? So our residents, engagement with residents. We, as you know, one of the things that we really try to focus on is to combat isolation, to combat loneliness. Some people, by nature, like to be on their own, and that's fine. I may be one of those people. We'll see. But at some point, if we don't have our residents engaging and participating in social activities, that comes with a price. It's just not good for your health. And I'm really encouraged to see people acknowledging that more and more, the importance of connections, socializing, maintaining those connections. And that's one of the big things that we do for our residents here through programming and so on. When we survey our residents, as we do on a very regular basis, we hear what's going great and we hear what could be done better. And so this year, a couple of themes emerged. And one of those areas was the need for more variety and more options for socializing and engagement. So there's some work going on in that area, which I'd like to share. Also, our team, I'm super proud of the work that we do around the food that we prepare and serve here. There's a ton of pride that goes into that work. There's a lot of care and attention. We have an amazing team, but we have very limited resources. We have a limited budget for food that is provided by the ministry, although it has been improved in recent times. But we've heard from our residents that they would like to work with us to improve both the food and the dining experience. And one of the ways that we do that, and I'll get to this a little bit later as well, is by engaging with all of you, with residents, with staff, with volunteers, with families, to say, what are some ideas for improvement? And then we will work with the team to test and experiment different ideas to improve that. So for this year, that's our focus. You will see changes to the activity calendars. You will see new activities being introduced and rolled out in the very near future, and as well in the dining rooms. We will be working on that. At some point, when it comes to food, there needs to be some improvements and changes and investment to the infrastructure and the tools that we provide our staff to provide great food. That is going to take longer, but it is emerging as a really important area for us to pursue and invest in. So I'm very pleased to see that, because there's no use doing surveys if we're not going to be responsive to what we hear. So this is a real area of focus for us in the next little while. Next slide, please, Tom. So our Center of Excellence. This is still new, so I wanted to spend a couple of moments with you to first explain what it is and why it's important. So our Center of Excellence sits on 3 pillars. One is the amazing care that we already provide. Number 2 is research. So research that could look like evaluating the care that we provide, documenting how it's done, and then knowledge translation. So sharing that information with other long-term care homes to help them. Why do we do this? Really, the first reason is to develop actionable knowledge to help amplify and improve the care that you're already providing to our residents. But we also believe in the greater good. So I use the word oasis here. We should not be the only oasis in the city and in the province. People all across Ontario deserve excellent care. And we know that sometimes we have an unfair advantage. We're a very large long-term care home. We have great support from volunteers, from donors, from Veterans Affairs, that other long-term care homes simply don't. And so because we're a charity, we believe in sharing the information that we develop, the best practices, and so on. So one example of that is wound care. We've made amazing strides. And for those of you who have a loved one, or if you're a resident who has dealt with a pressure injury, you know that is not something to be taken lightly. It can lead to tragic consequences. And we've done a ton of work to improve that. And we are super proud of the improvements that have taken place there. Now the next step is to support other long-term care homes so that residents elsewhere don't need to suffer. And so there are resources that we are developing, have developed, and that we are prepared to share with other organizations. As time moves on, our vision is to have that be even more hands-on so that we can come up alongside other long-term care homes and give them the support. What would that look like? It could be coaching other long-term care homes. It could be teaching them, training their staff, whatever the case may be. So we are really looking forward to moving that ahead. And in the meantime, please get to know our Center of Excellence team led by Danny Sinden. They don't bite. So this isn't science class. You're not going to find any test tubes, Bunsen burners, or beakers, or anything like that. It's really about engagement. It's about understanding the great work and the care that we already provide, helping to amplify that, but also helping you to do your job better as time moves on. So that is my invitation to you. So, Tom, if we can go to the next slide, please. number of seniors that the number of seniors that are going to be surrounding us as Ontarians and Canadians is going to double very, very soon. And while that's very nice in some ways, our system's not ready for that at all. We already have 40,000 people on our waiting list for long-term care beds across the province. There are just over 60,000 beds in the province. So here at Perley, that ratio is even higher. We have well over 1,000 people on our waiting list for long-term care beds, and we only have 450 beds. So for us to support the greater good, one of the things that we've committed to doing, if the seniors population is going to double, we need to double the number of people we serve. And when we do that, really what we're doing is maintaining the wait list where it is now, but that's an important first step. So that's a commitment that we've made, is to double the number of seniors that we serve by 2035. So we have a bit of time to accomplish that. What could that look like? It could look like increasing service. As time moves on, some of the services that we provide could grow. It could also look like new facilities. And if we move to the next slide, some of you may have heard, and the government has been very, very public about this, is their commitment to add at least 30,000 new long-term care beds in the province. And so what they're doing is turning to long-term care homes like Perley Health and say, will you please build more long-term care beds? And that's what we're trying to do. So they have granted us up to 240 additional long-term care licenses. And that's a project we've tried to get off the ground for quite a few years now. COVID did not help with that. I don't think I need to go into the reasons why we couldn't do a construction project in the middle of COVID. And a project like that is still far from certain. But what I did want to do today is just plant the seed that we are cautiously optimistic that we will be working towards an announcement at some point, hopefully in the next year, to say, yes, we are moving ahead with new long-term care beds. Our investigation of where to put those beds is limited to this site. We don't want to move off-site at this point because we have so many wonderful amenities that we want to share with new long-term care residents. So we're doing a lot of work with architects, with engineers, and also with the foundation. The foundation has very generously agreed to do a study to see how our donors and potential donors would respond to a request to support the construction of new long-term care beds. There is quite a bit of funding available for a project like that from the Ministry of Long-Term Care, but it's not enough. It's called a subsidy. So it's meant to support your project. Fundraising, donor support, and probably some borrowing would be required to make that project go ahead. So again, it's not certain, but there's enough positive signs that we're investing some energy and effort into that project. And we would love to see that go ahead. And speaking of the foundation, Tom, I see you're ready to click. Thank you very much. A huge, gigantic thank you before I wrap up to the foundation. You're looking at a photograph of most of the members of the campaign cabinet who just recently announced victory. They managed to raise $10 million to support exceptional care in our Center of Excellence. They did this under exceedingly difficult circumstances. Half of the campaign was conducted in the thick of the pandemic, which, as you can imagine, was very difficult, but they did it anyway. So it's amazing. So thank you to all of our donors, to all of our volunteers, to everybody, whether you donated $1 or you helped with an event or whether you donated $2 million. Thank you. It doesn't matter. It all went towards our growth and the support that we're trying to provide to you as care providers here and also to our Center of Excellence. So with that, I am now going to turn the microphone back to our moderator, Jay, and I'm happy to take any questions that you may have.
Thank you. Oh. Thank you, Akash, and yeah, appreciate your kind words and comprehensive summary of what's new at Perley Health. So we will open the floor to questions now. If you click on your reactions and then raise your hand, I'll be able to see if somebody has a question to add. So maybe while people are ruminating over that, I think I would pose a question to you, Akash, and can you talk a bit about the People First connection and coming out of COVID and how it was a priority set by the board of directors and yourself?
Mm-hmm. I don't really like to remind myself or others of just how difficult the pandemic was here. But it's important to acknowledge that. It is important to acknowledge what a toll it took. And I mentioned some of the data that we monitor when it comes to human resources. And things blew up in terms of turnover, for example. We're not alone. That happened everywhere. But when you think about the impact that that has, not just on residents and families, but on staff, on the team who are here. And when you see your team members changing all the time and so on, it's just very hard. It introduces a lot of risk, and it's not what we like. We're very proud of the fact that we do not use agency staff, and we want to invest in the people that we have here. So when the storm clouds were gathering years ago, I mean, you can look at demographics and it tells a pretty big story. We knew that the population of Canada and Ottawa was going to age. And now we're really seeing that impact. And so when we looked at our strategy, well, what can you do about it? And this is how People First came about and has led to some of the sometimes very small things that we're doing, but when you add them all up, we're hoping that it'll make a real difference. So again, the recognition that we provide to our staff, the engagement with the leadership team, the focus that we're putting on diversity, equity, and inclusion. All these areas all roll up to People First. And, you know, I think it's really important to pay attention to that. I'm very proud to be invited to the orientation session. I don't know if we have any new recruits on the call, but every month there's an orientation session that takes place. It's we're just paying more and more attention to what that looks like and how to respond to the needs that our new staff have, and to make sure that we get off on the right foot and that we move forward. I could go on, but I'll pause there.
Great. All right. And I see a question, a hand up from Laird Eddy. So Laird, if you want to take it away, we'll unmute you so you can ask your question.
Not a question, but a couple of comments. First of all, thank you for doing this. This is great. And I think it really is helpful to those of us who are family members to hear directly from you some of the wonderful things that you have on the go. The second comment I just wanted to make is in reference to something you said earlier. I know as family members, we can sometimes always find the things that we would like to see improved and let you know about those things quite verbally. But in reference to something you said earlier, we are, at least in my experience, very grateful to you and to the Perley for all the things that you do to care so well for our loved ones. It's a recognition of the fact that we as family members also have a part to play in this, that we cannot expect the Perley Health to take care of everything all the time, because that's just not realistic. And so we as family members have a part to play, and we do our best to do that to help you as you are helping us. And so I want to say thank you to you for that, because we are, I know from speaking with other family members, we are grateful for the way in which you are so intentional about improving the care for our family members. Thank you very much.
Thank
Great.
you, Laird. That's very, very kind of you. And let me thank you and all the family members here at Perley Health, because your commitment, not just to your loved ones, but to the work that we do is very apparent. I really feel like we're a team. And it's neat to see what that can do and how we can move forward together. So thank you.
Thank you, Akash, and thank you, Laird. I have a question in the chat from Shirley Shea, and the question is, has there been any further progress on the Veterans Wall? This endeavor was talked about during the pandemic, and I believe this is the Hall of Honor that was discussed and announced perhaps around the time of the rebrand in 2021. Akash, do you want me to pick that one up?
Yes, I can add, but if you wouldn't mind taking the lead, yeah.
Okay. We have started to make some incremental changes in that hallway, the first and second floors of the Rideau Link. We recently put the sign up for to remember a famous vet whose name escapes me at the moment, Jesse Chenevret, and we have plans for a large photo. Part of the concept is large images of veterans whose lives were impacted by living here, and sort of telling their story adjacent to it. So that is certainly in development for sure. And Akash, I'll pass it over to you.
Okay, thank you, Shirley, for highlighting that promise that we made. And what I will say is, it is very important. The care that we provide to veterans is not the only important thing. Demonstrating it in other ways that people can appreciate is equally important. So we're very pleased to rename the Rideau residence, the Rideau Veterans Residence a few years ago, and other initiatives like that. So again, thank you for the reminder.
Not seeing any hands. It's me. Oh, no, I'm not seeing any hands up. Akash, I have a question that came to me earlier today, and maybe you want to pass it along to Rachel DeKemp, Director of Nursing, but it was a discussion about how vacation scheduling has been improved at Perley Health to benefit staff.
Yes, Rachel, if you could speak to that. What I will say is, as a vacationer myself, it's something I absolutely recognize the importance of granting adequate time off. I am held accountable as a leader to demonstrating work-life balance in action, and I do try to do that. And I was very pleased to hear that we've been able to make some improvements. Rachel.
Yeah, thank you for that. Thank you for the question, Jay. I just want to highlight to everybody that during the pandemic, of course, staffing was incredibly challenged. And in this past year, we have been able to hire quite a number of staff to fill a lot of those gaps. And as a result, this year, we've been able to support vacation requests to the tune of more than 60% from last year. So we're upwards about 79 or 80% of PSWs, nurses, being able to have the vacation that they've requested. The difference is palpable among a lot of the units. So I'm really pleased for that. And thank you so much to our team, because it's an incredible endeavor to look at the big picture to see if we can meet all the care needs while still granting vacation. So thank you for that. And I'm glad to see that that's happened.
Thank you, Rachel. On that note, and another topic that's come up recently is the announcement of foot care, a Perley Health foot care program offered to residents. And Akash, I wonder if you could speak to that, or if you'd like Rachel to chime in.
Yeah, Rachel, if I just keep having to make sure, yes, I'm unmuted. Good. This is it. The way foot care fits into the work that we've been doing for the last 10 plus years is it's always looking for ways to, again, meet the needs of our residents and tenants in the surrounding community. There are still gaps, so this was one of them. And Rachel, do you want to speak to that?
Yeah, thank you. So foot care, we used to have a third-party service come into Perley. And about a year ago, they had changed their model so that they were just moving to a clinic model and no longer coming to the residents in person here. So we made the decision to start our own foot care service here, of which we had hired an RPN internally who had that expertise. We have since grown that service so much that we require 2 RPNs to do foot care. So we have 2 RPNs. One has recently actually just become an RN. So now we're currently recruiting for a second foot care RPN. And the reason that we do need 2 is because we are going to be expanding the service to our tenants in the apartments, as well as the convalescent care patients right now. So once we recruit that second nurse, we'll be in great position to expand the service. And then looking forward, who knows, we may be in a position to offer more, but at the moment, we're going to expand it to the apartments and convalescents, which is really great. And these 2 nurses are fantastic, and they go into the residents' rooms, and they'll go into the tenant apartments as well. So it's a fantastic service. Very proud of that team.
Thank you.
Great. Akash, I'm wondering if you can speak a bit about the care clinic at Perley Health and the story behind that new brand and presence within Perley Health.
Yeah, if we go back in time, Perley started really almost exclusively as long-term care, full stop. And as time went on, because of the size, at one point we were the largest long-term care home in the province, and the resources that brought, what came with that was a recognition that we could be providing more to the surrounding community. And that was one of the drivers behind creating that clinic. And it has evolved over time. It started as kind of a teaching facility, so an opportunity, for example, for physiotherapy, nursing students, and so on to learn. But it has evolved into more of a focused clinic, like you would find in a mall or what have you, that provides a range of services to help meet the needs of the people on our campus and beyond. At the end of the day, this kind of work requires an element of entrepreneurial enthusiasm, if I can put it that way, which can be a challenge. We work in healthcare, and people who work in healthcare are not always here for a swashbuckling adventure laden with risk by starting up new business lines and different things like that. But that is actually what is needed. So it's one thing to recognize the need, for example, for audiology services, for physiotherapy. It's another thing to package that in a way that makes financial sense for the organization. Again, we're a charity, but part of what being a charity means is making sure that you can pay your bills and making sure that services that you provide have revenue that cover the cost of providing those services. We are not entitled to profit. We don't have shareholders that we would distribute our earnings to. Every penny that we earn here over expenses gets reinvested in the organization. But the flip side of that is it is not sustainable for us to have businesses or services that lose money, because that is taking away resources that could otherwise, for example, be provided at the bedside within long-term care. So it's been a journey, but I'm very, very proud of the team leading the care clinic, because it's doing exactly what it's supposed to be doing. It's meeting the needs of our residents, our tenants, and beyond, and it's doing it in a financially sustainable way. So as time moves on, if we can keep doing that as an organization, that's really, really encouraging, because what we're seeing there is a form of growth without having to go to the government and say, please, can you help us? The government doesn't have any money either, and they don't want to hear from stakeholders like us. They want to hear us coming to them and saying, we know Ontario, we know Ottawa has many problems. We're here to help, we're here to serve, we're here to support, and that's what we're trying to do.
Great, thank you. I do have a question in the chat, and I see we've got about 17 minutes left if needed. The question is, and I'll also give Rachel Steparchuk, Coordinator Volunteer Services, some advance notice here. The question is, have you been able to increase the number of volunteers needed at the Perley? As you're aware, volunteers were depleted during the pandemic. That's from Shirley Shea. So Akash, if you want to pick up a response, and then we'll ask Rachel Steparchuk to add.
Yes, yeah. Sorry, Jay.
Sorry, Rachel's not on. My fault. So
that's okay. I'll do my best. The short answer is yes, we have. What happened during the pandemic was completely understandable in terms of the number of volunteers that we had on our roster. It diminished very significantly. What does that do? It puts a heavier burden on the remaining volunteers. It means residents don't have access necessarily to all the programs that they want. They don't necessarily have the companionship that they had before, and so on. Again, very understandable, but massively alarming, because we, before the pandemic, had 800 staff and 400 volunteers, so an additional 50%. And some of our volunteers work more than full-time hours, so they're an incredibly valuable resource. To see what the pandemic did to the team was, again, alarming. And again, part of the people first strategy is to say, how can we fix that? So the team led by Rachel have been very, very deliberate in terms of forging new connections, rekindling existing ones. And I don't have the number in front of me, but I think we're almost back to pre-pandemic levels when it comes to our volunteer team. So again, thank you to any volunteers who are on the line, and to the volunteer leadership team as well.
thank you, Akash. And Mary Boutette's on, and she would like to add to that answer as well. We're just going to unmute her.
Hi, Shirley. Thank you as well for your question. And actually, Rachel Steparchuk, who leads our volunteer services program, actually she gave a presentation earlier this week on this exact topic. So as Akash said, volunteers are just so critical to the work that we do. And she and the team have been working to rebuild the volunteer program. I can confirm that we are pretty much at pretty close to pre-pandemic levels, as Akash had mentioned. And one of the real enablers here, there have been two real areas of focus. This past year, with some funding from Veterans Affairs, we were able to hire a veteran liaison coordinator who's been really wonderful at connecting with our veteran community outside of Perley, and engaging with that community around volunteer opportunities. And then we also have a larger number of student volunteer programs that really have started over the last several years. And this is wonderful for both the students, but also for our residents. Akos spoke earlier about the value of intergenerational programming. Many of these students are high school students, and it's wonderful for them to learn about the lives of our older community members and how they can support. And it's wonderful for the people who live with us as well to experience some of their enthusiasm. Rachel has noted that, one of the challenges that I think we're going to see ongoing in terms of volunteerism is the profile of volunteers is changing in that, people might not have quite as much individual time to contribute, or maybe volunteering with us if they're a student, for example, for a couple of years while they're here. And so that means that we need to continue to focus on recruitment and retention for our volunteers, and not over rely on what we like to call super volunteers. And I think I may see at least one of them on the call today, who really contribute many hours individually. And that is so appreciated. We also need to be working with people too who may just have several hours to give, and what does that look like? So thank you so much for your question, Shirley. And if anyone would like to know more, I'm sure Rachel would be, more than happy to share that presentation or information, maybe at an upcoming Friends and Family Council.
Thank you, Mary. Melissa Norman, Director of Quality and Interprofessional Care. Do you have anything to add on that?
Yeah, I think it's worth to note. I think Mary did a really great summary of the information that Rachel shared with our Quality of Life and Safety Committee Monday. But I do also have kind of some of the more specific numbers on my computer, because I held the pen on kind of sharing the deck. And so I think what's really interesting to note, and I think a testament to the work that our volunteer services team does, is that they were actually able to increase kind of year over year from last year, 15%. In terms of the volunteer base. And so in 2023 alone, we added 148 new volunteers, bringing our total to currently around 341. And if we compare that, in 2020, we dropped to around 233. And so we've been able to kind of increase kind of our volunteer base from 233 up to 341, which is really just shy of our median rate since we've been collecting this data. So we typically sit into the mid 300s. And so we're really just shy of our pre-pandemic levels. Their goal is always to hit around 400 annually, again, because of the cycling of the volunteers and that nature of short-term volunteerism. Their goal is always to be in and around the 400s. And so I think what we're seeing here is kind of a testament to the work that they're doing and the new streams of volunteers that we're able to successfully bring on to support all of the really great things that we do for residents on a day-to-day basis.
Thanks, Melissa.
Thanks, Melissa. Akos, another question for you that you may want to also bring in Rachel, the Camp Director of Nursing again, is to talk about sort of some of the new additions in the staffing complement. I'm specifically referencing the registered practical nurses.
Mm-hmm. It's been a very interesting last few years. I remember I joined here in 2008, and by then, I think there had been 10 years of advocacy to increase the average hours of care per day up to 4 hours across the province. So now we're 15 years later, and now I think it's taken something like 25 years to get the long-term care system to that point. What did it take? It took a lot of things, but one of the key things was increased government funding for staffing. And so we've been able to take advantage of that. The money by itself doesn't solve the problem. You need great people. And so that I think, Rachel, could I ask you to speak to that fun part?
Yeah, no, thank you for the question. So you're right, the 4 hours of care has been actually embedded into the legislation of the Fixing the Long-Term Care Act. So the target for 4 hours of care is to be met by March 31st, 2025. And some of the things that we have done in the last couple of years to reach that target is to add some additional staff, not only in nursing portfolio, but also in other areas in the allied health area as well. So for instance, we have added a PSW on days and evenings. We did that about 2 years ago to support the direct hours of care. RPN positions, so we have added the second foot care nurse. We have added a wound care nurse. And then there's other areas in the allied health, like for instance, in the social work, in OT positions that we have added to support that. Now, in terms of recruiting the RPN specifically, I will add too that this isn't directly related to the 4 hours of care, but we have been able to start using what we have on site as a living classroom for the practical nursing program, which is, we did that back almost 2 years ago now. And we've been able to successfully recruit a number of those practical nurses to Perley, which does help support the 4 hours of care as well. So we're really proud of that. We're on target to meet the 4 hours of care, and actually we're pretty much there. So we're ahead of the game to meet the 4 hours of care by March 31st, 2025, which is really great. Thank you.
Congratulations.
Thank you, Rachel. I see we're about 7 minutes away from an end. I'm just last call for questions. Akash, we are coming on the heels of an AGM and the announcement of a new board chair, former vice chair, Lloyd Campbell, former leader of the Royal Canadian Air Force. And our foundation announced yesterday their new chair, Sheila Venman. So congratulations to both of those individuals. Any comments about your support from the support you get from the boards and the work we've got in front of us?
Yeah, I mean, actually, Jay, the first thing that comes to mind is that we've got a fighter pilot as a board chair. My dad was a fighter pilot as well in World War II, so that has, I haven't told Lloyd this, but he knows that, but what he doesn't know is that this is kind of a remarkable turn of events for me to have a retired Air Force commander as board chair. Our board, and I'm not sure everyone knows this, but there's a separate organization here, which is the foundation, has its own board. So they're two separate organizations, but the two boards collaborate very, very closely. And both boards, I'm happy to say, are extremely committed, hardworking, and very, very strong and connected to the community. At the end of the day, what's the role of the board? Part of their role is making sure, that the organization has its finances in order, that we're following legislation and so on, that we have a strategy that we're executing. But the really, really, really important part of the board's job is to make sure that the work that we're doing here is actually responsive to the community that we're accountable to. So that's what we have. And along with that, a ton of skills. If you look at who's joined the board, we've got people with a really strong veterans background, but also people who have supported mental health initiatives, who have a clinical background. It could be a nursing background, a medical background, so on, financial experts. And these are the people who really amplify our efforts, because in my job, it can be kind of lonely at the top. I'm not lonely. I'm super well supported and extremely grateful for the relationship with the board, which I will say as well, sometimes is a cheering section, but usually is more about accountability and making sure that we're aligned, we're moving in the right direction, and that they're supporting our efforts. So yeah, I think we're going to have many great years ahead with that team. And I know what I will say before we wrap up, I know they are curious for how to engage with the people on this call a little bit more as well. At the end of the day, they're volunteers. They already spent a ton of time attending board meetings, preparing and committee meeting, all that kind of stuff. But hopefully you've noticed, and you'll notice more effort in the future to have them engage more with staff, with residents, and so on. So at the very least, they understand better the care that we provide here, but also to give you a chance to interact with them. Thanks.
Thank you, Akash. And we're closing in our time. I can't miss the segue. We talked about the Royal Canadian Air Force fighter pilots. I think we're safe to say this pilot project is going to take off. I think it's been a very successful first online town hall, and I appreciate everyone's input and attendance. We had well over 50 people here today. We had probably almost double register, so we certainly will. There will be a need and a desire for a video copy of this so that people can watch, and we very much appreciate it. I will reiterate that if you have a personal issue or concern that cannot be addressed during the town hall or has not been addressed, or questions, please contact us directly at info@perleyhealth.ca. And I thank you for your cooperation. And with that, I thank the team and everyone for a successful first town hall.
Thanks, Jay, and thanks to everyone for joining us today. See you soon.
Thank you.